Hi, I'm Dr. Jack West, and I am an associate clinical professor in medical oncology at the City of Hope Comprehensive Cancer Center, where I also serve as the clinical executive director for Access Hope, offering remote consult services for patients with cancer. It's important to recognize that any anti-cancer treatments we give can have good or potentially harmful effects when combined together. And because of that, it is very important for oncologists to select a treatment approach that we have evidence for and we know is safe as well as ideally effective against a cancer. In some cases, we've found that certain interactions can be very harmful. Certain chemotherapies, particularly a chemotherapy agent known as gemcitabine, was found, unfortunately, in early studies to be associated with very high toxicity when given with uh, with radiation. And so patients who were on even very low doses of this agent gemcitabine, commercially known as Gemzar, developed high toxicity rates when given chest radiation alongside that. And in fact, patients can even develop unpleasant side effects if the chemotherapy with gemcitabine is not overlapping, but similar in time. It just started a little before or after the radiation. Another agent that can have potentially detrimental effects is bevacizumab, also known as Avastin. It blocks the tumor's blood supply. And when given to patients with lung cancer, and patients also receive radiation to the chest, they can develop difficulties with healing essentially the wound or the burn from the radiation, and can develop a hole and a connection between the esophagus and the trachea, the main windpipe. And so we have learned from that experience to be very cautious about giving bevacizumab anytime patients are getting chest radiation. But overall, there are many, and I would say most agents that are routinely used for lung cancer have been studied with radiation to the chest and found to be safe to administer. But we feel far more comfortable about that when we actually have evidence rather than just presuming that to be so. And so as newer agents, whether they are immunotherapy or new targeted therapies, are introduced into clinical practice, into the marketplace, we should be cautious about combining them with other modalities like radiation without having sufficient evidence, because we sometimes find that there can be a detrimental interaction if it hasn't been studied. And it's always preferable to pursue approaches for which we've already got the evidence establishing safety and ideally efficacy as well.